Hello and welcome to today's podcast brought to you by ISCCM, where we explore the forefront of critical care medicine. We are honored to have Dr. Pradip Bhattacharya sir with us. We all know him as the President of Indian Society of Critical Care Medicine. He is a professor and HOD of Critical Care at RIMS, Ranchi. He is also the Dean of Research and PhD Coordinator. He is also the in charge of trauma and central emergency there. He is a distinguished leader in critical care medicine and is known for its contribution in the field. We welcome you, sir.
Thank you for inviting me.
Welcome, Professor Pradip Bhattacharya to ISCCM Vodcast. So let's discuss the ISCCM per se and your experience and your tenure in this vodcast. So my first question to you is, ISCCM from the inception over the last 30 years has gone leaps and bounds. So we would like to listen from you. What is your take on the growth of ISCCM and how far we have reached in expanding intensive care practices in India?
Okay, Jacob, actually, I tell you, I joined, I first I attended this ISCCM meeting in Bombay Hospital, and that was organizing secretary was Dr. Praveen Amin, 1995. That was my first conference which I attended, and it held in Matusri Auditorium of that Bombay Hospital, and I got so much attracted towards this field because I basically was doing anesthesiology, and when I saw that yes, what is the right way and what should I choose as my future, at that time that instinct came to me, and that yes, critical care is the subject which I should look forward. But obviously, everyone thinks that how you are going to get the openings, that is very important. Okay, it is basically luck also. So I remember how it started after I finished my residency and everything, 1999, 2000. I remember that at that time, after finishing my residency from All India Institute of Medical Sciences, I thought, how should I go for critical care? Because I did almost 1 year of training in All India Institute of Medical Sciences in critical care. And after that, I was looking for a good opening. So I went across many institutes, and Gangaram was one of those institutes in Delhi. But somehow I got convinced with one of my teacher. He said, if you want to grow, you join an institute. And AIIMS is currently full of faculties, and no permanent appointments are being done. So better you take and go to Bhopal, and you will see that you are getting whatever you expect from your critical care subject. So I joined a super specialty hospital on the advice, because my selection, everything happened in AIIMS. All the drivers were sitting in AIIMS, and I joined that hospital in Bhopal. That was a tertiary care hospital, Bhopal Memorial Hospital and Research Center. I remember 450 bedded hospital, huge one, and all super specialty discipline. And that was the starting. I first independently started a critical care setup in Madhya Pradesh. It was year 2000, June, I remember. That was my first venture. That is how I started my career. As far as attending this ISCCM, after that, I regularly started 2001, 2. I remember Delhi conference when I interacted with so many international faculties and all senior leaders of our country. That was the point when I met. And thereafter, there is no look back. I remember 2007, it was Chennai when this conference was going on. I was here and I was very keen to do this national conference in Bhopal. And I had to bid for that. We placed a bid from our city, and then there was an interview taken by all the board members, because at that time, executive committee used to decide which city will organize the conference. So that is how 2007 I got it in Chennai, and 2008 I did the first national conference as an organizing secretary in Bhopal. And that was a huge success. Obviously, at that time, I was not as a regular executive committee member. I was a co-opted member. But immediately in 2009, I got elected as executive committee member in ISCCM. And after that, continuously I opted different posts, two times executive, then followed by vice president, then secretary college, secretary, general secretary, society, then again vice chancellor, and finally the president. So no look back after that, and constantly, and I have seen all those senior members who are currently those who have served this ISCCM as presidents, their contribution I have very seen from very close, watchful eyes, that how they have performed, how they have made this ISCCM to grow from zero to today's state, where actually we are proud that yes, we are one of those societies in the entire world, which actually, if you say we are going to become the third largest economy in the world, I'll say probably we are the third largest and biggest society to be recognized as far as entire world is concerned.
Excellent answer, sir. That is an inspiration and a clear message and a pathway for further development also. Thank you, sir.
So from ISCCM, we would like to move to one of your other favorite field, which is research. What do you consider are the most vital areas of research in critical care today?
Yes. You see, that is one thing, basically, other than academics, which is very, very important for any medical subject you consider, be it critical care or any other subject. In critical care, we know that because we always play between life and death, and when we are working with a kind of population, it is a huge heterogeneous population, and it becomes very difficult to come to a right inference at the end of any research which you are doing. Then it becomes a question that, okay, how to proceed? And that is why probably you have seen that in last almost 15, 20 years, we have not got any good positive outcome based research in any part of the world. So I think now the way we are proceeding towards precision medicine and artificial intelligence, I have a faith that yes, if we start from today, because our country we understand bit late, and that is another reason why we always stay behind others. Others mean one or two big continents like Americans and Europeans, that we get triggered a little bit late. So if we start working from now on, basically these two, that precision medicine means we need to understand about inside biologics and the phenotypic pattern of individual and diseases, and then we make all these included with the help of artificial intelligence, and we start making big data, because those are the things from which we can actually extract, because they will take all the heterogeneity which we see in our ICU, and they can combine all those heterogeneity into one point, and finally they can give out some conclusion if our data is very correct, which we have fed into the system. So that is why I think one aspect is obviously precision medicine, artificial intelligence. The third one, which I feel that basic research, that is one thing. Suppose today I say, how many critical illnesses, like in our ICUs, uh, we have tested urine for different kind of particulate matters which comes out through urine, the chemicals which comes out through urine, the biological materials which comes out through urine. We have never tried that. So if we have a very good biochemical analytic device in our institute which examines the urine, we can find out many things out of that, and we can make many conclusions. Obviously, we see that urine examination we always keep as an intensive at the last. But I don't think that it should be kept at the last. It is one of those important things from where we can get many clues for our diseases. So, in that way, I say, like arterial blood gas, if somebody says there are many hidden facts which are there in arterial blood gases, we never try to explore. So, if we, so these are the basics, what I am saying. Uh, in ventilator also, we see the parameters we see always, but as far as analysis is concerned, how we are analyzing those parameters which are being shown in ventilator and how we can put it to infer and see that yes, what we can do after this so that our patient gets a better ventilatory support. So those are basic things on which we can focus and we can prepare our future programs of research. Another important thing is which is coming, I feel, is the extracorporeal therapy, because that is one thing which I feel that in future it will really take over like anything, because that is one technology which is advancing. The way the liver transplant initially that used to show bad results, and today we see almost 80% success with liver transplant. Similarly, currently although we are saying that extracorporeal therapies may or may not be showing good results, but I see that future is there. So extracorporeal therapy is another area where we can really do very good work and we can come out with good researches and we can good results and outcome we can give. So these are some of the areas where I think, and genomics is one thing where we need to hit, because today, on the as per the requirement of higher studies, we need to have it in genomic labs. So many institutions have opened genomic labs and multiomics. Basically, wherever we can do these multiomics, we can definitely see the endotypes, what we call it as an endotype. Phenotype is outside and endotype is inside. So through multiomics, we can identify the endotype of any person and we can make very good research out of these.
Thank you, sir. Thank you for answering this question so well. So, precision medicine, AI, genomics, and the basic research which can actually have the greatest impact on patient outcomes in your future, we should focus on.
Professor Bhattacharya, we will
Yes.
move to your tenure as the ISCCM President now. All reasons, it was a very, very successful and happening year. That is what the general feeling. So we would like, and a lot of initiatives have happened in this 1 year time. So could you please elaborate about what all initiatives you have taken and how your goals have been met and what is the future?
Yes, I tell you that when I took over, I was a little bit terrified at that point of time, because I saw that yes, there are so many things which was there in my mind, whether I'll be able to execute all those things during 1 year time or not. But I'm really thankful to my team, especially Dr. Bharat Jagyasi as a secretary and Dr. Srinivas Samavedam as a president-elect, because we are just right and left. They were sitting with me for all that. Whatever program I has to think, they are there to execute those programs. So neck to neck with me and step to step organizing for all of my programs, they executed everything in such a nice manner that today I feel that whatever I thought of, barring 5-10%, I have been able to execute almost everything. And I'm not only thankful to these two people, but also my executive committee, because there are many contributions from my executive committee members who have helped in different way, and we reached to this state. As I said, uh, how the first thing which starts when as soon as you take over as a president is the election that comes to your mind. Now, this year there was a challenge because there was no vendor for election to conduct the election. And election process, as all of you know, that is one of the most controversial thing which happens usually. What we have seen in last 5-10 years, that maximum controversy goes on when we take elections in ISCCM. But this year, you must have seen that entire election was absolutely smooth without a single controversy or bias. So I again give the credibility to the team who were all involved with this election. And after the election, we are gearing up for our Eurasia. Eurasia, we did it although there were financial constraints, but successfully we did it with the very good help what we got from the local Bangalore team as well as from our executive committee. And this was the third Eurasia which we did in three consecutive Eurasias which were promised to Europeans, ISCCM society, that these three will do. And after that, there will be a re-signing of MOU. So, because of budgetary constraints, I do not know, but Dr. Srinivas has to see, but it will be difficult because it happens that it creates a lot of problem for the future. That is why probably if we get a proper MOU signed as per our need through Europeans or ISCCM society, then we'll conduct those conferences in future. Otherwise, probably it may come in a different shape or a different manner in future. So after Eurasia, because Eurasia was again almost attended by 800 delegates, and we saw almost 14 European faculties, they were there, and it was a very good success. Then there was another good thing which we did is that we shook hands with NATO organ. All of you know that this is National Organization of Tissue and Transplant organization for conducting transplant. So we shook hands with NATO, and there was a meeting on 3rd of August on that was the 14th National Organ Donation Day. They gave an award to us as the best supporting society for organ transplant in the country. And on 11th of August, there were again another meeting with them, and they said that every SOTO or whatever which are functioning in the country, they will walk neck to neck with the ISCCM to make all these organ donation and organ retrieval programs across the country successful. So that was another big development, and probably it will come on paper very soon. And then we conducted, as usual, the Teachers' Day. Then our DEI summit, which was there during the ARDS time, that was again a huge success. And then our ARDS Day, that was one of my brainchild, because I thought we must do it because it is not being done anywhere in the world. And during that, in the ARDS summit, you must be knowing that Professor B.N. Gangadhar, he came as a chief guest. And at that time, we discussed with him that there is a problem with the entrance exam of DRNB and DM, that anesthesia subject has been removed. And you must take it seriously because many anesthesiologists are interested to join critical care. Then he took it seriously, and within 3 months, we saw that there was a gazette notification that all the entrance examination for critical care for DRNB and DM, the subject will be critical care and not medicine or anesthesia. So that was a big achievement which has happened. And during ARDS Day, you must have been evidence that there were so many international faculties who are involved. And I feel that because we were the person who started ARDS Day in our country, it should continue for years together, and we should be considered as the country who actually started this ARDS Day in the entire world. After that, we did this Sepsis Day celebration on 13th of September 2024. And as far as go to the research and guideline side, if you see that this year we took a promise that we'll make some guidelines by utilizing this grade methodology, because nowadays that is the only thing which is considered as the appropriate way of making guidelines. So we took the help of Dr. Bram Rochberg, and after that we are in the verge of finishing almost 4 guidelines which will be made as per the grade recommendations. So that is another new thing which has happened. And once this trend starts, I think in future everybody will take this grade methodology to prepare guideline, and that is the methodology which is internationally accepted, and you get all the credits which are actually given to the guidelines. So that is another important thing. Position statement, almost we are making around 6 and 7 position statements also this year. Then another big landmark which we have achieved this year is that we have signed MOU with almost 6 societies in the country with the association, because it was although we used to go and to participate, but there was no signed MOU with these societies. So this time we have made a signed MOU that will continue for in the all coming years, and ISCCM and all these societies will do combined meetings, academics and research works with Physicians of India, with Anesthesiologist ISA, with Chest Society. Then we did it with SEEDS, Clinical and Infectious Disease, then Indian Society of Organ Transplant, and also FISF, the Fungal Infection Society Study Forum. So all those MOUs have been signed, and we have started a synergy session in the conference also, that all these people from these societies, they should come and they should give their deliberation during our national conference. So that was another achievement. Then we celebrated our annual ISCCM Day in Mumbai. Then another important thing I tell you, this 10-bed ICU, which Dr. Sheila actually signed an MOU with this group. In 10-bed ICU, they actually wanted us to be a knowledge partner. So they were about to prepare around 28 modules, and we made a team from our ISCCM, almost 8 to 10 doctors, 8 to 10 ISCCM members were there. And all of them, they worked day and night, and they prepared almost 28 modules for these 10-bed ICU. And we organized 2 physical or contact program, so that train the trainers program, you can say, one in Guwahati and another one in Bangalore. So there are 2 programs which were conducted, and almost 200 doctors from 10-bedded ICU who were running different intensive care units in Northeast and South, they got trained in these programs. Then this year we made this 4C course also in physical mode. We have revised so many courses like CCIDC and others. And that is one thing which was pending for 3-4 years, because CCIDC was getting old, and also the 4C wanted to be to come in a physical format, and that is one thing which has happened, and I'm thankful to the Kolkata Society for that. So as far as tie up with Noto is concerned, we also have requested to start a KOTO also, means this is a city organ and tissue transplant organization, because we see that we have city branches, 102 city branches. So if these KOTOs are formed, then it will be easier for our city branches to coordinate with them for all their organ transplant programs, which is going to be held in the country. And I have invited Dr. Anil Kumar. He is the chairman of NOTO in our conference, and he'll be there. And we have decided to give one special award to one of those ICUs who are doing excellent work in organ transplantation in the country. So myself and Dr. Anil Kumar, both of us will hand over this memento to the ICU or the hospital who are doing remarkable work in organ transplantation. So that is another thing which we have started. And another most important thing which I thought of was that as per the theme was the empowering community against critical illness, because this is the theme, and for that I assigned this heavy role to our vice presidents and asked them to conduct as many programs as possible in their different zones, so that most of those doctors who are non-intensivist or those who do not have any awareness about critical care, they should become aware about critical care. So almost what I see at the end, what data which I have received, almost 8,000 doctors across the country have got this training of critical care, and they have been made aware about the critical care. So we did an outreach program in Goa. There also we have trained almost 400 doctors, and I myself was there, visited, and it was a highly successful program. We trained people from police line, we trained people from colleges, then we trained people from medical college where the students were there, but they were having no knowledge of critical care. Almost 100 students were there. So in that way, that was a huge success in Goa. That was an outreach program. And we have put a starting point for Indo-Asia Fellowship Program. And very soon, I think, format has been prepared, MOU is almost signed, and in very soon we'll be starting an Indo-Asia Fellowship 2-year fellowship program that is already started, but I think Dr. Srinivas will take over that, and gradually it will take over. And not only that fellowship program, but here in the country also, we, as I said, we thought of doing this a fellowship program with Europeans. That was another important thing. I have extended an MOU with that, and with NABH recently we made a tie-up, and NABH has given us the access, and they have said you will be our knowledge partner. And I already have sent the MOU. They just have asked to refine it a little bit as per their need and requirement. So they have said you people will stay as knowledge partner for NABH. There they said that teaching, training, and making of quality standards, all those things, you will be our knowledge partner. And the most important thing what they have said is that your intensive care unit now can be recognized separately, even if your institution is not ready for that. So if you feel that your intensive care is ready for NABH recognition, you just directly apply and you get your certification of NABH. So that is another good thing which I have done. So there are many small things. I think this is some of the things which I thought of at the beginning, and I have been able to execute. And for that, as I said, my entire team from top to bottom, everybody has contributed in a different way. And rest all, I think you people have got time constraints. So I'm not describing all those things here, but definitely during the conference here and there, I'll be telling what all other things I have done for the society this year. Thank you.
Thank you, sir. Inspiring, impactful, covering the core critical group and outreaching to the all corners of the country. And the leadership, the team has done a tremendous job. Hope and pray that your insights will be available for the society in future also. Thank you for that wonderful answer, sir.
That was a great summary of the entire year. Now we'll come to a last question. So everybody is waiting for the most awaited event of ISCCM, the Criticare, which is happening in Kochi this year. So what to expect in Kochi, sir, this year? What are the highlights of the conference?
Okay, Monalisa, I tell you, I think I have put my maximum effort for this conference. I have not put so much effort for other things. And Jaicob is here. He knows how many times we visited Kochi and how minutely we are looking for each and every activity which we are going to do during this national conference. And I have a very high hope that yes, this is going to be a conference with difference. This time we have made little bit of changes from the standard format which we are following in our ISCCM conferences, because we have made one hall extra for synergy session. That is one thing which, as I just now said, that we have made a tie-up with 6 other societies, and we have taken time from all these societies, and they have sent their scientific agendas also. So what they will be doing in the synergy hall. This time, another new thing which I have done is because I saw that yes, postgraduate students, when they come for this conference, they feel neglected. So to avoid that kind of psychology, I have started this postgraduate lounge for them. So there is a separate postgraduate lounge where this will see all those IDCC fellows students and DRNB and DM students. They are there, and the small activities which we have kept so that they can have fun, they can pass their time, and they can enjoy the entire scientific of this critical 2025. Now, as far as academics is concerned, Dr. Srinivas has done a very good job. He has prepared a beautiful scientific agenda for the entire conference. We have kept some additional workshops also this time, like a soft skill workshop. That is one most important thing which is required for our ICU practitioners, because if we do not have good soft skills with us, many a time we land up with problems. So soft skill workshop, then data interpretation workshop, then on demand I have kept this datathon. You must have heard about Datathon, because that is one thing which has been started in Western world. India is yet to take over about to understand. We do not know what exactly Datathon. So I have kept a workshop for artificial intelligence and Datathon. That is another one. So in that way, I have kept four, 5 new workshops so that people come to know about, even if they do not have awareness about those. So they should come to know about those workshop, and they should understand what all these things are there, and because they are important from intensive care point of view or critical care point of view. So in workshops we have kept many attractions for the industries also. The industry, we are trying that most maximum industry should participate and they should enjoy. And as usual, this time I have another important thing which I have kept is that in last 20 years, you see many 20 presidents have come and they have served and given so much to ISCCM, but they never got praised by anybody that what they have done for ISCCM. So this time I have kept a separate session. That is why I have shifted this presidential citation on 6th, because on 7th what I thought, I'll call all the past presidents on the stage and I'll felicitate them with a memento for their courageous and tremendous contributions which they have done for ISCCM. So that is another important thing. So if I go on counting, there are so much, but I feel the best way to understand is to attend the conference. So my request to both of you, that motivate more and more people to attend, to enjoy this conference, because there are many more things to come, and Jaicob is evidence to everything he knows, and he has been part of all our meetings. So that is why I think it is going to be a very good conference, and a conference with a difference.
Conference with a difference. Dr. Pradip Bhattacharya, thank you so much for telling about what is to expect in March 5, 6, 7, 8, 9. I think the entire country and the entire intensivists all will be looking forward to meet, because on a personal note, I have to tell that I witnessed in close quarters how the president himself has taken each and every minute details to his own heart and giving us instruction to make it happen. Sir, I think we all will pause for the time being and let the surprises come one by one for all the delegates and the faculty who's going to meet up in Kochi from March 5 to 9. Thank you so much for taking you through the entire journey. Wishing you all the best in the coming conference. See you in Kochi.
Thank you. Thank you,
Wind up
Jaicob.
this.
Thank you, Monalisa. Thank you.
Thank you, sir.